Good day, everyone. I am JFA Estinias Makalipay, a BS in English second year. Welcome to Ed2F4 Foundation's Special and Inclusive Education. Today, we will talk about the Unit 3 typology of learners with special needs, specifically learners with intellectual disability, and the two types of intellectual disability, which are the cerebral palsy and trisomy 21, known as Down syndrome. What is typology of learners with special needs? These are the students with special needs that may have difficulties in managing their own behavior and feelings. They may be too loud, hyper, disruptive, talkative, and etc. There are 8 typology of learners with special needs, but we will just talk about the learners with intellectual disability since it is my given task. What is intellectual disability? Intellectual disability is defined as a significant loss in capacity to comprehend new or difficult knowledge, develop new skills, and operate independently, including social functioning. Disability to read, write, think, spell, talk, listen, or perform mathematics. Intellectual disability can be caused by a combination of genetic issues and infections. It is not a disease nor a type of mental illnesses like depression. There is no cure for intellectual disability. However, most children with intellectual disability can learn to do many things, just taking them more time and effort than other children. They can do well in school but is likely to need individualized help that's available as special education and related services. Learners with intellectual disability may face difficulties in cognitive and muscle development. Signs of intellectual disability: sit up, crawl, or walk later than other children. Learn to walk later or have trouble in speaking. Have trouble in solving problems. Have trouble in thinking logically. Find it hard to remember things. Do not easily understand how to pay for things. Have trouble understanding social problems. Have trouble seeing far consequences for their actions. The two types of intellectual disability are the cerebral palsy and trisomy 21, which known as Down syndrome. Cerebral means having to do with the brain, while palsy means weakness or problems with the using of muscles. Cerebral palsy is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. It is a group of disorders that affects person's ability to move and maintain balance and posture. It is the common motor ability in childhood. What happened to child with cerebral palsy? A child with cerebral palsy may face challenges with muscle weakness and stiffness. Some children might have trouble with slowness or shakiness, and they may not be able to control their movement. Balance, coordination, and walking can also be difficult. The physical and mental challenges of cerebral palsy can affect a child's ability to learn, while physically challenges may challenge the child's ability to participate and stay focused on lessons. Children with cerebral palsy may also face diminished cognitive capabilities. There are 4 main types of cerebral palsy. First is spastic cerebral palsy. People with spastic cerebral palsy have increased muscle tone. This means their muscles are stiff, and as a result, their movements can be awkward. There are 3 types of spastic cerebral palsy. First is spastic diplegia or diparesis. Muscle stiffness is mainly in the legs, with the arm less affected or not affected at all. People with spastic diplegia might have caused their legs to pull together, turn inward and cross at the knees, or known as scissoring. Second, spastic hemiplegia, hemiparesis, affects only one side of a person's body. Usually the arm is more affected than the leg. Third, spastic quadriplegia or quadriparesis, the most severe form of spastic cerebral palsy and affects all 4 limbs, the trunk, and the face. People with spastic quadriparesis usually cannot walk often, give other development disabilities such as intellectual disability, seizures, or problem with vision, hearing, or speech. Second is dyskinetic cerebral palsy. have problems controlling the movement of their hands, arms, feet, and legs, making it difficult to sit and walk. Sometimes the face and tongue are affected and the person has a hard time sucking, swallowing, and talking. Third, ataxic cerebral palsy. Have problems with balances and coordination. They might be unsteady when they talk. They might have a hard time quick movements or movement that need a lot of control. Like writing, they might have a hard time controlling their hands or aims when they reach off something. The fourth one is mixed cerebral palsy. Some people have symptoms of more than one type of cerebral palsy. The most common type of mixed cerebral palsy is spastic and dyskinetic cerebral palsy. Here are some examples of cerebral palsy. The second type of intellectual disability is trisomy 21 or known as Down syndrome. This is a condition caused by an extra chromosome. Trisomy 21 can affect learning abilities in different ways, but it usually causes child to moderate intellectual disability. Children with trisomy 21 have delays in speech and motor skills and may need help with self-care, such as dressing and eating. People with trisomy 21 will typically have some level of learning disability and characteristic physical features. There are some health problems associated with this, such as heart problems and difficulties with sight and hearing, but this will not affect everyone with the condition. They may have specific challenges with attention span, verbal memory and expression, or expressive communication. Children with trisomy 21 is at greater risk for certain medical problems and may develop the following. Here are some examples of children with trisomy 21 or known as Down syndrome. That's all for my topic for today. Thank you so much for watching.